Yes, ma'am.
Thank you, Sahab.
Yeah.
And Dr. Sumana Kumari Panda.
Thank
Good
you, thank you.
evening.
Dhanesh ji.
Good evening, good afternoon, and good morning. This is the 1661st day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Pavithra Gaur. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. We have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30. From 8:30 to 9:30, we have the international session in English, and from 9:30 to 10:30, we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who miss the session can watch it again. You can subscribe the same without paying any money, and you can share it with your friends. The purpose of this forum is to take homeopathy to every home around the world, as well as to connect between doctors around the world, doctors as well as students around the world. We are very happy to say that we have presentations from doctors and eminent personalities from 65 countries in this forum, and all the presentations were exemplary brilliant. And today, let me come to today's guest. As you all know, Dr. Pavithra Gaur is from Delhi, and she has completed her MD in homeopathy, no, BHMS, and she is doing her MD in Materia Medica. She is a gold medalist in BHMS, and she has published many articles in various journals, and she is very much interested in research. So we can hope that one more fellow is will be joined in our CCRH in the in the later part of this year, this season itself, I must. And she has more than 3 years of clinical experience. She has presented some presentations in or Hindi as well as in English session earlier. And today, Doctor will be discussing about a specific disease, that is Gaucher's disease, a rare disease and managed through homeopathy. That is the subject of the day. So we proudly welcome you to the session. Okay.
Thank you so much, sir. Am I audible?
Yes.
Can I share the slides, sir?
Yes.
Good evening, everyone. Firstly, I would like to thank Sahani sir and Ganesh sir for inviting me again for presenting my topic. So for today's evening, my topic is managing a case of Gaucher's disease through homeopathy, a case report. So basically, we are acquainted with the word or the disease, Gaucher's disease, but we are not acquainted its treatment through homeopathy. So basically, in today's webinar, we'll be getting a slight insight of how to manage Gaucher's disease through homeopathy, and also to further explore what a Gaucher disease is and what the patient can appear or present with the symptoms of Gaucher's disease. So, to begin with, Gaucher's disease. Now, Gaucher's disease is the commonest of lysosomal storage disease. So, to further classify, lysosomal storage disease, these are basically a group of 70 rare inherited metabolic disorders that affect lysosomal functions. Now, what are lysosomes? Lysosomes, as we all know, are basically the recycle bins that break down and recycle molecules using specific enzymes. So, in Gaucher's disease, it is caused by deficiency of lysosomal enzyme beta glucocerebrosidase, leading to build up of fatty substance called glucocerebrosidase in the body. So, since there is a deficit of glucocerebrosidase activity, the phagocytosed substrate glucocerebrosidase cannot undergo the further catabolism, and in such situations, macrophages secrete chetotyrosidase enzyme in proportion of degree of overload. So now, in this case report, there is basically the main things which we have to focus about is Gaucher's disease. Then there comes the homeopathy treatment. Then there comes the mother tincture which we have used, and for all the managing things which we have dealt with. And lastly, there is chetotyrosidase enzyme, which is very sensitive biomarker for the Gaucher's disease. So it is the commonest lysosomal disease. And the symptoms with which the patient might present is fatigue, anemia, along with there is enlargement of liver and spleen. Glucocerebrosidase glycolipid contains fats which can accumulate in spleen, lungs, kidneys, brains, liver, and bone marrow, and it can result in elevated levels of chetotyrosidase enzyme, which I've already told is a very sensitive biomarker in Gaucher's disease, which is produced and secreted by pathological storage macrophages. Now, the Gaucher's disease is further classified into three types based on the involvement of the central nervous system. There are three types: type 1, type 2, and type 3. So in type 1 is basically a non-neuropathic form which presents in childhood or early adulthood. The type 2 is acute neuropathic form that presents itself in the childhood. And type 3 is chronic non-neuropathic form that is progressive, slowly progressive, and presents itself in childhood. And since I've gone across a lot of researches, so in one of the researches in modern medicines, which I have found out, so patients with type 1 Gaucher's disease have been reported to be more likely to suffer from polylithiasis. This is a flowchart which explains the same thing, like deficiency of glucocerebrosidase enzyme, which results in decreased catabolism or hydrolysis of lysozymes. Lysozymes break down excess or worn out parts, which results in accumulation of certain fats, glucocerebrosidase, glycolipids, and which results in enlargement of spleen and liver. Now, sign and symptoms, eyes. So what are the sign and symptoms in which of the eyes with which the patient can present in the OPDs? Like difficulty in eye movements, yellow spots in the eye, blood, there might be anemia, fatigue, thrombocytopenia, bones, joint pain and damage, weakened bones, arthritis, osteoporosis, osteonecrosis. Brain, there will be difficulties in coordination and motor skills, cognitive problems, seizures, developmental delays. Lungs, there are breathing difficulties. Liver and spleen are enlarged, due to which there usually the patient presents with excessive pain, burning, and usually in the region of the spleen. And when you palpate it, there is of course hardening at that site with very sensitiveness mark in that area. Now, to begin with case report. So the patient XYZ, age of the patient was 30 years, females. She was married since 8 years, food habit vegetarian, and occupation, she was housewife. Presenting complaints with which the patient presented, she was suffering from pain over the left side of hypochondrium. Pain was intolerable and was burning in character. So the pain was excessively intolerable and burning in character with which the patient was suffering. There was easy satiety after few mouthfuls, and still patient felt heaviness after eating. Numbness and tingling was experienced in the upper part of the body. Exhaustion after slight exertion. There was also dyspnea, which was marked, which is also a common symptom which is found in Gaucher's disease patient. Since there is excessive enlargement of the spleen, so because of that enlargement, the patient is unable to breathe. So there is not that was sufficient inflation of lungs. So because of which, even if the patient is walking slightly, she might experience dyspnea. So there is difficulty in breathing, which was aggravated in midnight, burning and perspiration over palms of hand and soles of foot, salivation from the night, or you can also say drooling from the mouth in the night. This was the presenting complaints with which the patient presented. History of presenting complaints. Now, patient was apparently well 8 years ago, after which the patient started experiencing constant pain over the left side of the hypochondrium with bloatedness and heaviness. Appetite got reduced, and patient went for investigation in 2022, and there was raised chetotyrosidase enzyme. Now, this was the investigation which was carried out in AIIMS, Delhi. This is one of the report in which you can see that there is chetotyrosidase enzyme, test enzyme. Patient value was 24,217, which was excessively raised. Then there was normal control, deficient control, and normal range. So to further classify this report, or to help you further understand this report, normal control value is basically, it represents basically the average enzyme activity level found in healthy individual, and it serves as a baseline reference that this amount can be found or usually found in healthy individuals. Now, deficient control value. This is an example of extremely high enzymatic activity. typically seen in patients with certain lysosomal storage disease. So this value is used as a reference point for what is highly elevated ketotirosidase levels that look like in severely affected patients. So if a patient is severely affected, the raised value would be 48,491 near about. Normal, if the patient is healthy, it is 51.9. So basically, when this investigation was done, the patient value for the ketotirosidase test enzyme which came about was 24,270. So interpretation was basically raised activity of ketotirosidase enzyme. So for that thing, they diagnosed it as a Gaucher's disease. And so when patient visited us in the OPD, it was a pre-diagnosed case of Gaucher's disease. Now, past history, patient has a history of cholelithiasis since 8 to 9 years. And size of the calcula was around 8 mm, which was still persisting when the patient visited the hospital. Treatment taken, patient was on innumerable modern line of treatment since 8 years, but there was no significant relief in her complaints. The complaints were getting worse by worse, and in modern line of treatment, they were asking her to go for another mode of treatment. So because of which she came for homeopathy treatment. Mental generals. Now, patient by nature has a yielding disposition, usually compromises with her desires without thinking. She usually suppresses her emotions and prefers to spend time alone from the crowd. Her health condition has made her quite distressed since she has started experiencing her health conditions. So these were the mental generals which came across during the visit of the patient. Physical generals, appetite was highly reduced and meals was twice in a day. She was experiencing easy satiety after few mouthfuls. The patient wasn't eating very good, and even if she was eating few bites, she used to feel heaviness in the abdomen. Thirst was extremely reduced, small quantity over small interval of time, and 2 liters in a day. Hardly she used to intake 2 liters in a day. Patient had unsatisfactory stool, felt as if she was constipated. Stool was hard in consistency, and it was once in a day. There was desire for sweets, mostly, but not that prominent desire. Urine was normal, which used to be 3 to 4 times in a day. Night made there was no desire. Perspiration was profuse extremely on palms of hand and soles of foot, non-staining, non-offensive. Thermal reaction was towards hot, since she cannot bear to sleep without cooler, even in the initial days of summers. Takes bath from cold even in winters, and avoid covering her body during sleep. Sleep was highly disturbed, slightly because of difficulty in breathing experience. Avoid covering her face and sleep. So this was the physical generals. Menstrual history, age of Minaki was 11 years. Menstrual flow usually scanty from the beginning. Cycles used to be 3 to 5 days or 23 to 25 days. Dark colored bleeding and clotted slightly. Obstetric history, 3 female child and they were normal delivery. Sexual history was healthy. History of vaccination, she was fully vaccinated. Family history, we didn't found anything specific. Appearance, thin and weak in appearance. BP was 120 by 40. Respiratory rate 14 per minute. Pulse rate 72 BPM. Conjunctiva was pale and tongue slightly white coated and slimy. Sclera slightly yellow, not prominent though. Systemic examination. Upon patient felt tenderness over left hypochondrium on inspiration and abdomen was tense. Actually, the abdomen was extremely hard. Even on slight touch, you can feel that extreme hardness is there with pain, and patient can see with that much bloatedness in the abdomen. Now, this was the analysis of the case which was done, and it was repertorized through synthesis repertory. So, based on mental generals, physical generals, in particular, the symptoms were classified, followed by the totality of the symptoms. And these were the symptoms that were taken in the totality, like yielding disposition, suppresses her emotion, company is unbearable, tries to spend time alone, quite distressed because of her health condition, easy satiety after few mouthfuls, heaviness in abdomen, which was aggravated after eating, perspiration was profuse on palms of hand and soles of foot, pain over left side of hypochondrium, intolerable pain and burning in character, numbness and tingling in the upper part of the body, difficulty in breathing, aggravation midnight, saliva from mouth, drooling in night. Now, this is the repertorial analysis based on the totality of the symptom, this was the repertorial analysis which we came across. And after through rigorous search in the materia medica, basically boric materia medica was referred for this case, and based upon the repertorial totality and the symptoms corresponding, the prescription was sulfur 200 single dose, which was given early morning, empty stomach. 4 pills of sulfur 200 potency on 21 to 23 was prescribed, which was to be taken in the morning, early morning, empty stomach, single dose, after which placebo thrice in a day was given for 15 days initially, and follow-up was taken after 15 days. Investigation advice, since we wanted to know, is there any abnormality in the liver, since liver is also affected in the Gaucher's disease. So because of that, we advise liver function test on 21 to 23 on the basis of the presenting complaints of the patient, which was experienced by the patient. Now, as you can see, in this case, there is raised alkaline phosphatase, which was 40.35. Decreased alkaline phosphatase, which was 40.35, bilirubin total 1.26, which was near about in the reference range. Then bilirubin direct, which was 0.6 in the raised, which was raised definitely. And then there was bilirubin indirect. There was 1.20 milligram per deciliter, which was raised. Total protein 9.7, which was raised, and albumin 4.2, which was near in the reference range only. So depending upon this, the treatment was started. Burning in the abdomen, and in the next follow-up, when the patient came, there was burning in the abdomen and pain in hypochondrium got reduced in intensity. Stool constipation has relieved. Daily passes stool soft in consistency. So initially when patient visited, there was a hard stool and it was hard in consistency. But after treatment, the stool got soft in consistency and constipation was relieved. Numbness and tingling was still present, but less in intensity. Appetite, easy satiety. The patient was still unable to take a sufficient amount of food or the meal. Burning over palms of hand and soles of foot was still persisting. There was no relief in difficulty in breathing. Saliva still drooling in night. So still we wanted to see that how much sulfur 200 can manage the case. So 5 and 30 thrice a day was given for 15 days. Now, in another follow-up, the next follow-up, pain and burning in the abdomen was very much relieved. Difficulty in breathing was very much relieved. Reduced intensity of numbness and tingling sensation in the upper part of the body. Heaviness in the abdomen is also relieved. Appetite satisfactory than before. Patient started eating 3 to 4 chapatis per meal. Appetite has increased and there was no relief in drooling of saliva. Patient was advised LFT. Now, we also started fighting thrice a day was given for 15 days, but we also started Sion at the SKU TDS. Since it was a pathological condition, so we thought to start the specific mother tincture for splenomegaly, since it's a very good medicine for splenomegaly and liver complaint. So we started Sionathus Q TDS, which was given 15 drops in half cup of lukewarm water thrice a day. Now, after this follow-up, we advised LFT and albumin level was reduced. Total protein and bilirubin indirect values were reduced. Bilirubin value and alkaline phosphatase value came into within limits. As you can see, initially it was less, alkaline phosphatase was less, but after a few follow-ups, we can see that it came, it's like near about in the reference range, 52.52. Then bilirubin total was in the reference range. Bilirubin direct was in the reference range. Then there was bilirubin indirect 0.37, that is in the reference range. Total proteins was before it was more than 8, that was 9, that is 9. But after the treatment taken, after taking the treatment, total proteins came under 7.03. Albumin was 3 within the reference range only. Now, another follow-up at 6/4/23 when patient came, there was relief in pain and burning in abdomen, which was extremely reduced. Relief in perspiration over soles of foot and palms of hand. Numbness was not experienced by the patient since last follow-up. Appetite has also increased. Drooling of saliva was better. So we thought to give the same prescription or to repeat the same prescription. So Python 30 twice a day was given for 15 days, followed by Q in the same dosage, 15 drops in half cup of lukewarm water thrice a day. Then patient came for 6/4/23 only. We advised for USG whole abdomen to evaluate the improvement in the symptoms to correlate clinically. There was, so after advising USG, there was a presence of echogenic foci in the gallbladder. As you can see, this is the figure A and figure B. On the left side, there is figure number A, and right side, there is figure number B. So on the figure number A, as we can see, investigation was done in year 2022. This was the investigation which was done in year 2022 before patient visited the OPD. And in figure number B, USG was advised during the ongoing treatment. So as we have initially in the beginning of the webinar, there are three types of Gaucher's disease: type 1, type 2, and type 3. And I've told that in type 1 Gaucher's disease, there is a probability of finding polylithiasis, or the patient might suffer from polylithiasis. So basically, this is one of the common symptoms or common anomaly which we can find in Gaucher's disease patient, that is polylithiasis. So when patient came with this reports, we were certain that it's a type 1 Gaucher's disease because of the presence of polylithiasis since long. So in figure A, we can see that 4.9 mm common bile and contracted few calculi. In figure number B, we can see that there contains bright echogenic focal calculi contracted, and common bile duct 4.3 mm. Now, there was highly hepatomegaly and cholelithiasis, which can be we can see in figure number 2. Now, after this, 22/4/23, when patient visited the OPD again, there was heaviness and pain, which was not felt by the patient. Difficulty in breathing was less in intensity from before. So these were the two symptoms which were highly controlled, and same prescription was given. Then patient came at 7/5/23. Heaviness, burning in the abdomen, along with difficulty in breathing is relieved. Urine flow intermits with pain felt in lumbar region, and which was aggravated in morning. Emptiness in gastric region in morning. Heaviness over umbilical region. So, based on the repertorial totality, again, sulfur 200, 1 dose, early morning, empty stomach was prescribed, followed by Phytum 30 TDS for 15 days, and Q was, as per the previous follow-ups, we continued Q TDS in the same potency and same dosage. Now, for this another follow-up, when patient came at 22/5/23, urine flow was better than before. Pain was less in intensity, which was previously felt, and heaviness over umbilicus was reduced. So we prescribed Phytum 30 TDS twice a day for 15 days, and Q was regular. Now, when patient came after 15 days, burning and pain over the left side of the abdomen is better than before, and urinary complaints, there was relief in urinary complaints also. So we prescribed the same medicine, and in the same potency, same dosage, nothing was changed. Another follow-up, there was complete relief in burning, heaviness, abdomen. Appetite was also better than before, and it has increased. So initially, patient does not used to take sufficient appetite, as there was satiety after few mouthfuls. But after few follow-ups, like majority of the follow-ups, we can see that there was appetite which was better than before, and it has also increased. So we prescribed the same medicine in the same potency. Then at 4/7/23, patient was advised RFT along with USG whole abdomen to evaluate the improvement in symptoms. So, because since patient suffered from urinary complaints, so we wanted to see, is there any affections in the kidney which because of which the patient is suffering from urinary complaints. So we advise for RFT and USG whole abdomen. So in RFT, serum creatinine was raised, and in USG whole abdomen, this is the report which we can see, and serum creat level was raised, that is 3.81. The normal reference range for which the serum creatinine should be 0.6 to 1.1 milligram per deciliter. So in this follow-up, we can see that serum creatinine is raised, And since in the previous USG reports, we have seen that there are few multiple ecogenic, bright ecogenic foci, which was there. So we also advise USG to see that is there any improvement. So in this, you can see that there is no evidence of polylithiasis in the USG report, but there was grossly splenomegaly with prominent PB, portal vein. So splenomegaly was still prominent since Gaucher's disease is an autosomal recessive disease. So basically, we have to ongo the treatment continuously because splenomegaly, we can just control it. That's why. Or another follow-up when the patient came, patient better in abdominal complaints and no symptoms. So initially, patient was very much distressed because of complaints, but as patient came and took the treatment, there was very much relief in the complaints, not only in abdominal complaints, but also the respiratory complaints, that dyspnea on least exertion, which she used to face, or on lying down or in midnight, or the easy satiety after few mouthfuls. These complaints were actually very much better, and burning, which was prominent in whole of the abdomen, this was also better. So, but since the serum creat level was raised, so depending upon few of the symptoms, we repertorized and we thought of prescribing pulsatilla 200 single dose, Phytum 30 thrice a day, 15 days, Cyanophis Q TDS. And pulsatilla here also was prescribed. One of the symptoms because of which was thirstlessness. Thirstlessness was prominent during this follow-up. And since we thought we repertorize depending upon the acute totality, so we prescribe pulsatilla 200 single dose. Now, 8/7/23, when patient was advised serum creatinine again to evaluate the creatinine level because there was no urinary complaints experienced. The value of serum creatinine was reduced from 3.81 milligram deciliter to 1.15 milligram per deciliter. So this was basically in the 9th follow-up that we prescribed pulsatilla. And in 11th follow-up, when the patient came, that is on the 8/7/23, we advised pulsatilla, we advised for the serum creatinine for the evaluation of the creatinine level. So as you can see, that creatinine level initially was 3.81 in the figure A, as you can see. But after the treatment, the creatinine level came about 1.15 milligram per deciliter. It came on the verge or the reference range, but it was highly reduced. So after this, the patient was continuously on Cyanophis Q TDS, which was regular, Phytum 30 TDS. Then on the next follow-up, that is around 24/7/23, there was no new symptoms which was experienced by the patient, and pain, burning, difficulty in breathing, easy satiety after meals, and heaviness got relieved. Appetite has also increased, and patient was eating well than before. So since it's a pathological condition, so we thought to continue with the mother tincture of Cyanophis Q TDS, Phytum 30 TDS thrice a day. Now, as you can see, these are the reports because since it's a pathological condition and we need to manage the disease, so we regularly advise all the investigation that we can. So this is the investigation which we advise, that is ALFT. And in this case also the reference ranges, as you can see, alkaline phosphatase was in the reference range of 227.2. Initially, it was 47 around, but now it was 227.2. Bilirubin total 0.47 milligram per deciliter. Bilirubin direct in the reference range only. Bilirubin indirect in the reference range. And total proteins was also in the reference range. Albumin 3.5. So as we can see that as the treatment is going on, the patient is getting relief or being managed significantly through homeopathy. Urine test. Urine examination test was also advised regularly, as we can see that color, appearance, pH, and specific gravity, protein, sugars, everything is within the limit, and there is no abnormality which can be seen. This is again since the patient was coming regularly and investigations was advised regularly. So these are the investigations which is carried upon. So again, LFT was advised. Now, this is the investigation which we advise CBC, RFT, ESR, and hemoglobin to see is there any abnormality in hemoglobin. So initially it was 7.1 gram per deciliter, which is of course low, since of course in the lowest range, since Gaucher's disease patient suffers from thrombocytopenia. So hemoglobin was 7.1 gram per deciliter. Then ESR was 54, which was raised. Creat was within limit 0.66, urea 13.47. So based upon the ESR and hemoglobin, we also prescribed vanadium ferrum met 6x. Then this was the investigation which was done after 1 year, and it's chetotyrosidase enzyme investigation which was carried out to see that is there actually any improvement which going on in this pathological situation. So initially you can see, initially there was raised chetotyrosidase enzyme which was around 24,217 nanomole per hour per ml. But after the whole of the follow-ups, you can see that the chetotyrosidase enzyme results is 5,243 nanomole per hour per ml. Though it's high, yes, definitely it's high, since it should be less than 400 or equal to 400 millimole per hour per ml. But we tried to bring it down to 5,243. So this was the main report which came across, and we also went for another investigation after 1 year, and the same result was there. The reports I have not added, but the same report was there, and the reference range results were same, that was 5,243. So patient has stuck onto 5,243. Neither it was decreasing nor it was increasing, but as we can see that there was significant improvement pathologically also. Now, this is one of the case reports which I have found from International Journal of Surgery case reports, which was published in volume 29, 2016. And in case report of polylachiasis in a patient with type 1 Gaucher's disease. Now, type 1 Gaucher's disease patient have several factors for gallstone formation. So there was a relevance for patients suffering from gallstone. The case report which I have discussed elaborates that there is also the patient suffers from polylachiasis. So type 1 Gaucher's disease, in type 1 Gaucher's disease patient, there has a several risk factors for gallstone formation. The factors which are responsible: increased biliary excretion of glucoceramide, advanced liver disease and cirrhosis, splenomegaly, inborn error of metabolism, chronic systemic inflammation, T-cell dysfunction, and insulin resistance to risk factors. So these are basically the which predispose an individual suffering from Gaucher's disease towards gallstone formation or polylachiasis. Now, a type 1 Gaucher's disease patient have several risks of gallstone formation. First, increase. This is exactly the same thing. Now, gallstone, during the hepatic secretion of bile salts and phospholipids decreases, the bile is lithogenic. Second, advanced liver disease and cirrhosis also contribute to gallstones. The high degree of liver involvement is significantly related to the high risk of gallstones. Third, splenomegaly present in most patients with Gaucher's disease is a cause of hemolysis, which increase the risk of gallstone formation. So these are basically the factors which are predisposes a patient of Gaucher's disease for the gallstone formation. Now, to come across, since there are some of the remedies which we really don't know regarding splenomegaly or the affections of the spleen. One of it is parum iodatum, in which stomach food seems to push up into the throat as if it had not been swollen, abdomen, fullness, even after a stuffed feeling as if she could not lean forward, scrofulous affections, glandular enlargements, and tumors call for this remedy. Now, Grindelia squarosa is credited with more spleen symptoms, dull pains, and fullness in left hypochondrium, chronic malaria, gastric in association with splenic congestion, induces paralysis, beginning in the extremities, and efficacious remedy for wheezing and oppression. In bronchitic patients, the sibilant rails are disseminated with foamy mucus, very difficult to detach, acts on the pulmonary circulation, asthma with profuse tenacious expectoration, which relieves, stops breathing when falling asleep, wakes with a start, and grabs for a breath, must sit up to breathe, cannot breathe when lying down. These are the symptoms which corresponds towards Grindella squarrosa. Now there is Quercus gladium spiritus, spirits which is prepared from spirit distilled from tincture of acorn kernels. It was first used by Radmacher for chronic spleen affections, that is spleen dropsy, antidotes effects of alcohol, vertigo, deafness with noises in head, takes away craving for alcoholics, give dose as below for several months, dropsy and liver affections. Useful in gout, old mariages with flatulence. So these are some of the rare remedies which we can use in splenic affections. So the main motive of this case report, although not all of the follow-ups are included, but majority of the follow-ups are included just to make you all acquainted with how was the this Gaucher's disease was managed through homeopathy with all the investigations which was advised during the course of the treatment. Also, one of the investigations, also second investigation of cheetotyrosidase enzyme, which I was unable to incorporate here, but which also showed that patient was stable onto that 5,200 value and neither decreased nor increased. So this was the case regarding Gaucher's disease. Also, I would like to share a testimony of the patient suffering from Gaucher's disease. The same patient of the case which I have discussed over here.
काफ़ी राहत मिली है दवाई से। जैसे पहले एकदम सोना था, एकदम ठीक हूँ, मतलब काफ़ी फर्क मिली है दवाई से।
पेट में दर्द वगैरह?
जी नहीं।
अच्छा, जो जलन वगैरह रहती थी
वो भी बिल्कुल नहीं है।
नहीं है?
जी नहीं।
अच्छा, और पहले खाने की भूख वगैरह आपकी
बिल्कुल
अच्छी?
नहीं थी, भूख नहीं थी, सो नहीं पाती थी, चल नहीं पाती थी। अब तो खाना पीना सब सोना ठीक है।
पेट में भारीपन वगैरह रहता है?
अब कम है, बिल्कुल कम है। पहले तो एकदम भारी था, अब नहीं है।
अच्छा, कैसा लग रहा है यहाँ से दवाई लेकर के आपको?
काफ़ी राहत मिली है।
काफ़ी राहत
जी।
है। अच्छा, चलिए।
Okay, so this was the testimony of the patient which we took, and it was just to make you all acquainted that yes, we tried to manage this case through homeopathy. So this was all for today from my side. Thank you.
Congratulations, Dr. Pavithra Gaur. It's really a brilliant session. You really show the beauty of homeopathy in this case, and you took the case in detail and
Thank you, sir.
you are able to find out what are the symptoms predominating and what are the medicines to be given after repetition. And even though you began the case with sulfur, but then you started giving phytum 30. What
Yes, sir.
was indication for that? And then you give this tincture also.
Yes, sir. Yes, sir. There were so basically, there were multiple medicines which were prescribed depending upon the acute totality, since main motive was to give the relief to the patient. So,
Definitely.
yeah.
Definitely, in advanced pathological cases, we can do in that way. Pathological prescription is a very good thing for treating the patient and curing the patient as early as possible. And at times,
Yes,
as a palliative measure also. What was the indication for this fight that I could imagine?
The phytum is basically the Saclac which we prescribe. So it was like just to give that mental relief to the patient that she is taking the medicine, since we are prescribing single dose of sulfur and patient is suffering from pathological condition. So there is psychology of the patient that, oh, you are just giving one medicine. Is it that sufficient?
Yes,
So
sir.
because of, yeah. So because
Yes,
of that, we have to give phytum 30 TD.
Usually we used to give as private practice biochemical remedies as a complementary remedy for this kind of diseases, particularly that affect the internal organs, that is the liver
Yes,
and
sir.
spleen, where in those cases we can think of some other medicines also.
Yes, sir.
But
Some other medicine. Yes, sir.
for example, you can think of this colostrum 3x is a very good remedy in that case.
Yes, sir.
So in those point of view, natural self also can be considered.
Yes, sir.
Yes.
Natrum sulf can be considered. But
Okay.
basically, natrum sulf affects on the lower lobe of the left lung. So if that affections we are finding, we can go for natrum sulf with injury and everything.
Well,
But
natural force can also be considered in those cases.
yes, sir. Natrum force can also be considered.
Natural force also can be considered. Of course, there are other medicines also, but I am not going in that way because you have anyway you achieve the target. That is what
Yes,
whatever
sir.
be the way. But in the all in all, in the last part, you give a dose of pulsatilla.
Yes, sir.
A dose of pulsatilla.
Pulsatilla, yes, because the patient was suffering from urinary infections also, and since there was raised creatinine level also. So, depending upon the acute totality, as the case needed, we prescribed Pulsatilla 200 also.
All the
So,
very
yeah, there was multiple of the medicines which were prescribed just to give relief to the patient because we know it's a pathological condition and we have to manage it.
But
So,
on looking at the case, what I found that it was a pulsatilla case in the beginning. But
uh,
there was a confusion that whether it is a case of pulsatilla or silesia, because
okay.
that was also some symptoms of silesia was also there.
Yes, sir. The sweat and
The video,
feeling.
after seeing the video, it looks like phosphorus.
But not exactly. She is phosphorus, like predominantly she's something else, and in front of the doctor, she's something else. So maybe that's why.
Okay. If anybody want to participate in this discussion or anybody having a doubt, you can raise your hand so that we will allow you to unmute yourself and you can talk to Dr. Pavithra Gaur. Yes, Dr. Bob Lim, please come forward. Dr. Bob from Malaysia is there. Okay, you speak, Dr. Bob.
Thank you very much. It has been a special topic and special case tonight, presented very well by Dr. Pavithra Gaur.
Thank you, sir.
Yeah, but it's usually the Gaucher diseases, they will affect, it's a genetic disorder, right? It will affect the
Sir.
young.
Yes,
So
sir.
what is the oldest age that you have treated so far?
Pardon, sir. Actually, I was not able to hear what you
How
saying.
old? How
How?
old is the patient?
How was the patient?
How old is the patient that you have
Old.
treated?
22 years.
20 over years, huh?
22 years. Yeah.
That was good.
Yeah.
Thank you very much. It was good. It was a good case. But I heard
Thank
that they cannot live to a ripe old age because of this Gaucher disease that is disturbing their physiological function of the body, and they become with all types of symptoms. Then, as a homeopath, I think you do it quite right. You treated according to the symptoms. Especially, I learned
Exactly, sir.
something new about the paritum, and Dr. Danesh also was quite interested in that paritum that you have been using.
Yeah.
Okay, thank you very
Yes,
much.
sir. Thank you, sir.
What we have noted is that there was a calculi in the
Yeah. There was gallstones which were present. Yes, sir.
it was relieved after taking this medicine also.
Yes,
So,
sir.
you have not given any specific for that, but instead you just continue with the chain and the changer.
They are not excuse. So since we thought if it's a common symptoms of Gaucher's disease and the spleen affections are the main, so we should continue with cyanotus Q. And then we thought, okay, we can go for USG to see the improvement. And we found out there was no evidence of calculi on the gallbladder. So there was again an achievement in the case.
Okay, and now I invite Dr. Mariamma John to say a few.
Madam, please explain the lab investigations to diagnose Gaucher's disease.
Lab
How-
investigations.
Lab investigations or how to diagnose Gaucher's
Okay.
disease.
Okay, Gaucher's disease, basically, as I already told, that there will be splenomegaly, hepatomegaly, excessive burning all over the abdomen, and then there is the sensitive marker, which is ketotyrosidase enzyme, which I've told is one of the sensitive biomarkers for Gaucher's disease, and so it's basically raised in the degree of proportion of overload. Since there is decreased activity of beta cerebrosidase activity, so on proportion to that, ketotyrosidase enzyme is raised in the body. So as you have seen, in this case, there was ketotyrosidase value which was extremely raised. That was 24,000. It should be in the normal range, less than 400 nanomole per hour per ml. So, of course, Gaucher's disease involves a wide range of investigations, USG also, but ketotyrosidase is the sensitive biomarker which you should go for, and you should find out that whether it is raised or within the normal value or deficient control value. So yes, ketotyrosidase is one of it. And then during the course of the treatment, there was LFT which was advised, RFT which was advised, USG which was advised. So yes, this is how the investigations were advised depending upon the need of the case. But yes, in the end also, twice during the course of treatment, we advise that enzyme which is sensitive, that is ketotyrosidase.
Thank you, madam.
Okay. Doctor, what kind of diseases you are getting in your hospital, being a medical college?
Yes, sir. Today only was my last practical, so I've successfully completed my PG. So, but yes, there was wide range of diseases which I came across, but this was one of the best cases which I have dealt in during the course of my PG. There are psychiatric illnesses also, schizophrenia, and then there are pathological disorders come across, but there are usually the same cases, allergic rhinitis and migraine, urolithiasis and anemia, and these are the things which are we are dealing with basically.
You have not mentioned about the miasms that cover in Gaucher's disease.
Miasm which is covered.
Yes, yes, miasms. We know that it's a.
Yes, yeah. So basically, there is an enlargement. I have not gone through for the miasmatic analysis, to be frank enough. But yes, since there is enlargement, there is enlargement. Initially, there was dysfunction and enzymatic dysfunctions which happened. So SORA is also included. SORA is the mother of all causes. So SORA is basically included. But then there is autoimmune disease. Autoimmune diseases which are transferred genetically, basically, or the patient which is suffering from those diseases through birth. So syphilis is the predominant SORA and syphilitic miasms. Since there is destruction, that's why.
Actually, there is some psychotic point also because it's
Yes, sir. Enlargement also. Yes, sir. So all the three miasms are included in Gaucher's disease.
Okay. Wow. What's your opinion? What is the present trend of doctors in homeopathy there in New Delhi?
Basically in Rajasthan, you're talking about the doctors, the trend of doctors.
Yes, you are in Rajasthan or Delhi?
I'm in Rajasthan. I'm doing I've done my PhD from Jaipur. Basically, sir, the people are growing over here. The knowledge is, they are exploring knowledges. They are very much interested in research. So the trend is going on, and everyone is evolving in homeopathy. So that's a good thing, which we are coming across.
Okay, what kind of support you are getting from the government of Rajasthan? Whether you are having this government dispensaries every panchayat or
Yes, yes, sir. We have dispensaries, although we are not that much good support, but yes, they are trying. They are also opening government colleges, medical colleges in Rajasthan. So yes, we are getting those opportunities also. There are also posts which are coming through government. Not much, but yes, that okay, we are getting things. So yeah.
How many homeopathic medical colleges are there in Rajasthan?
So basically, there are two government colleges. One is in Jodhpur, one is in Khetri, and then there are private colleges. The Homeopathy University, Swastika Kalyan, and Bikaner we have one, Alwar. So 5, 6 private medical colleges, 2 government medical colleges.
That means that the strength is very less when compared to other. The total of doctors what is there more than 5,000 or 10? What's your register number in Rajasthan?
It's
Other than 5,000 or 10,000?
10,035 basically.
10,000. Oh, that's a very good thing.
Yeah.
Under Rajasthan Medical Council, they all are registered under A-class registration. Am I right?
Yes.
Okay. Okay, now I invite Dr. Ramprasad sir to say a few words. Yes, sir.
Thank you, Dr. Dhaneji, and congratulations, Dr. Pavithra Gaur.
Thank you, sir.
Very nice presentation, excellent session, and rare disease presentation. Gaucher's disease. Gaucher's disease is a rare disease, and enzyme deficiency.
Yes, sir.
Enzyme deficiency, and according to homeopathic, treat the patient, not the disease. Sign and symptom. It is very good. So Gaucher's disease, the symptom is a very important. Our case presentation is a beautiful describe the medicine, selection medicine pulsatile. Gaucher's disease produce jaundice.
Yes, sir.
Jaundice like symptom.
Yes, sir.
Pulsatile is a very good remedy. Jaundice. Pulsatilla is the very good remedy. Jaundice, Pulsatilla, Chelidonium, Paduas.
Yes, sir.
Very good remedy. According to symptomological and miasmatical medicine, phosphorus, etc. Many kinds of medicine according to symptom. Like miasmatical, soric is the background.
Yes, sir.
Soric is the background, and three miasm suffer, soric, syphilitic, and psychotic.
Yes, sir.
So very, very thanks,
Thank you,
Dr.
sir.
Pavithra Gaur. Thank you.
Thank you, sir.
Yes. Yes, Dr. Boblim, you want to say anything about?
No, I don't. I think it's okay. It's a very informative session today. We talk about this rare genetic disorder where we have the lack of certain enzyme in the Gaucher diseases and the accumulations of lipids stored in the spleen and the liver that affect the patient, and it comes up to all kind of symptoms, especially dealing with liver and the spleen. So would it be possible if we can look into the liver organ remedy like cholesterol or chelidonium and also ocinum?
Cardis.
Thank you.
Thank you, sir.
Yes, Doctor, you can also invite your friends to this session also to take
Yes, sir.
session as well as a faculty as well as listeners.
Yes, sir.
Yes, our forum, we have uploaded some videos on the YouTube. You can share it with your friends and homeopathic lovers also. And thereby, we are promoting homeopathy.
Definitely.
Doctors as well as public also, because this is a very rare case won by homeopathy. So many such cases were presented by our faculties in this forum, and that we are able to upload some of them in the YouTube also. So anyway, congratulations once again, and
Thank you so much, sir.
I am inviting Dr. Mariamma John to say vote of thanks to the session.
Congratulations, Dr. Pavithra Gaur.
Thank you, ma'am.
On behalf of IFH, I thank you for a nice presentation. Please
you.
come again with another presentation. Thank you, doctor.
Thank you.
Thank you.
Thank you, Dr. Maria Majon, those who attended the session, and once again, thank you, Dr. Pavithra Gaur, for such an excellent session in this evening.
Thank you, sir.
Hope you can conquer homeopathy if you go like this. All the best for you.
Thank you so much, sir, for inviting me.
And tomorrow we will have a session from Dr. Mini Mehta, and
Thank you. Thank you.
and we'll be discussing about diseases of the women and its homeopathic management. With that, we come to the end of the day 1661. It's over to Dr. P. Shaila to moderate the Malayalam session. Thank you all. Good night.